Hey, you guys, so you are booked for photodynamic therapy, and we just want to walk you through what you can expect from coming in during the treatment and a little bit about the aftercare. So, first of all, what's going to happen is there is a chance that we might have primed the skin with topical vitamin D as well as oral vitamin D. If you don't know anything about this, don't worry about it. We don't prime all patients, but there is a chance that we might have given you a prescription that we might have spoken about this. What would happen is you would arrive, you won't see a physician on this visit. This is where you will only see one of our LPN nurses or registered nurses. What we will do first is do some photographs where we will take some highly specialized photos of the areas that we're going to treat. After the photos, the nurses will put you in one of the rooms, and this is where we want to make sure that you don't have any product on your skin. After you've washed your face or after confirming that you don't have any product on your skin, the nurses will use sunscreen, and this will be a chemical sunscreen. We can't use a physical sunscreen because that will block the light, because these medications are activated by light. So they will put a sunscreen all over your face and ears, if that's the area that we treat, or if it's your arms or your scalp or your chest, depending on the area that we treat. And they will put a sufficient amount of sunscreen on that area. After that, they would actually use a sterile curette. And a curette is basically a tool that we can use to just very gently scrape these precancers away, or these hyperkeratotic crusts, because as I've mentioned before, a precancer is like a turtle. It hides under scale. It protects itself with that scale. And this is where it's very, very important to use this tool by gently scraping off these precancers. Sometimes one or two of these lesions can be very painful, and this is where the nurses can actually offer to freeze it with a little bit of medication that we can inject to freeze it. Or sometimes if we treat a cancer, we won't scrape the cell necessarily, but this is also where we can inject some medication to help with pain and discomfort. But after scraping the skin, this is where we would use either one of two treatments, or medications, I should rather say. The first one is either Medfix. This is a cream, and there's only 2 grams of medication in here. And this will typically be an area that we treat the whole face and ears, or only one arm area with 1 tube of medication. And as I say, this is a cream that will be applied. The second option is Levulan. Levulan is a small ampule of medication that's in here that the nurses will crack. And then this is almost like a liquid-like of consistency, where they would then almost paint it on this area that we're treating. So this is a liquid, where this is a cream. The Medfix is a cream. And after we've applied, or after the nurses have applied these medications, this is where we would send you outside, where you can go and eat or drink something. You don't necessarily have to sit in the sun or be outside. If it's cold, of course, go inside, but you can basically for that 2 hours do whatever you want. Now, if we were treating a basal cell skin cancer, after we would have applied these medications, we also would have put a Band-Aid on the area that we're treating. And then instead of waiting 2 hours, you actually will wait 3 hours, where you're going to be out of our office. Now, after the 2 or 3 hours, this is where you return to our office. And this is where the nurses will start with the photodynamic therapy. And we will have a next video to discuss and describe that.